Hello and welcome. My name is Yanchi Wilson. I'm the guest contributor for MedEdge here at the Pure Lab Health event in Dubai. And I have with me Dr. Omar Najim, Chairman and Managing Director of BeehiveX, and also the former Director of Executive Affairs at Abu Dhabi, DOH.
Yeah.
Thank you so much for being here with me.
Pleasure. Thank you for having me.
So, in your current position, I thought it would be great to talk about that. What do you do at Beehive?
So BeehiveX is a science-based, data-driven behavioral change company.
Okay.
That is trying to put a new way or present a new way of how we change behaviors in general, and more specifically in healthcare. There are so many different approaches to behavioral change, including the old and tested approach of putting general messages to the public and hoping and praying they will hear them and they will listen to them. What BeehiveX does is use the latest in behavioral science and the data that can inform the application of that behavioral science in a new innovative way to achieve the maximum impact we talk about. So we talk about obesity, we talk about longevity, we talk about wellness, we talk about vaccination program, we talk about adherence to medications. All of these elements, they have certain challenges related to the behavior of the individual that is part of it.
Correct.
And what we need to do is work with stakeholders, work with the relevant authorities, with the relevant companies, with the, more importantly, with the public, on getting that behavior to a place where it's beneficial for them and beneficial for the wider society.
Absolutely.
And that's what BeehiveX does. So applying the latest in science, the data collected to drive them, as well as being agile, fast, and applying.
It's very interesting. That's really impact. We're going to go ahead and follow up with some additional questions. A little bit being on the patient side here, which is how do labs ensure that patients understand their test results accurately?
I think it's about empathy and understanding who the patient is. So again, we're talking about communication here. We as doctors, we keep learning about communication in medical school and the importance of communication. So no single intervention that healthcare providers can provide or a medication that we advise our patient to take is going to work without the right communication and without making sure that they understand it. A similar thing to results,
right,
or a similar thing to the procedure of taking the result. It starts with the doctor prescribing these tests to make sure that the patient understands why these tests and why testing in the first place. So it's a sharing and getting to empathize with the patient and to empathize with their fears, with their worries, with what make them tick.
Yeah.
And what would make them be part of the solution to what they are having, rather than just being a receiver of that solution without understanding. And that proceed into the medication as well as the test. So we need to put it, we always in medical school, always our professors or the way we get taught is, don't assume that people understand the medical language. You need to put it in that person's language.
Right.
It's not necessarily the language, the difference between Japanese, Arabic, or English.
Correct.
But rather what they understand.
Correct.
So it's going to be, I can't say that we shouldn't assume that everybody understands what a cholesterol test is. First, it's a very long word. Second, it's not necessarily translated in so many different languages and cultures.
Right.
And third, the whole thing of saying something that the patient or the person doesn't understand will lead them to unnecessarily being worried. So that means a lot of the times when we say it's a cholesterol test, what the patient here is, I have high cholesterol.
Correct.
It's not necessarily that we just testing for this.
Yeah.
And not necessarily that you would have it. Same thing, we'll test the level of your blood. I mean, I have a low level or too much of. So again, explain it in a way that the person understands, and explain as well what's potential of that test to be, and let's say within the normal range or outside the normal range,
right,
potentially want to do it. So it's just taking that time to to explain.
Yeah, it's very insightful. It's a very interesting way to put it, and it's simple, but it isn't carried behavior that needs to be adopted. So it leads me to actually asking a question regarding AI, because with the work that you do, I would imagine AI somewhat plays a role in it. So in what ways is AI being integrated into lab testing, and what benefits does it bring?
So let me take a step back. So my talk today was about the general driving factor for the changing face of laboratory testing. So laboratory testing is typically what it involves. It involves taking some samples, respect to what the samples are. It could be blood, it could be other samples, and testing it for different, what we call biomarkers. And then getting the results for the doctors or for the healthcare workers to form a clearer picture of what's going on with that test. Now, the driving factors that will be changing all of that, that's typically what happens today, let's say 95% of cases around the world. That's what labs do, and that's what they aim to make the processes more efficient, more cost-effective, and higher quality. Now, because of technology, things are changing. So the driving factors are, the generation we're dealing with today, and I know it's a commonly used words, it's a generation gap, and there's difference in generation, but it's more true than anywhere else. It's truer than anywhere else is in healthcare. So the individuals expect more from a healthcare system. What they see typically every 2 years is a new phone coming out of the production line,
Right.
that has more features, more customer friendly, and potentially either same price or cheap. They would be expecting to see the same in healthcare. They will be expected to see healthcare closer to that.
Yes.
Rather than traveling to healthcare, it will be closer. It will be more user-friendly, understanding how to use it, rather than being complicated mammoth with jargon language that is typically medical. Even between the different specialties, orthopedics don't necessarily understand what the internal medicine.
Right.
And third is to be higher quality and higher efficiency in it. And with the technology, so that's person expectation. Second is the technology that is reaching the core of laboratory work, more importantly, but also diagnostic a bit wider, and healthcare in general. Technology is affecting healthcare fantastically with higher impact. To the extent that individuals who didn't keep up with their skills and knowledge and experience of using the technology and applying it to their healthcare might be obsolete in a few years' time. I got educated in, let's say, the early 2000s in medical school. And I can tell you, I mean, the knowledge that I had during my medical school is not absolute, but the application of it and the face of applying it is completely changed today.
Correct.
My phone and my watch is providing more information than many of the devices I used to do when I was in medical school. So technology is changing it. And I'll come to the AI in a minute. And third, the world is presenting new challenges because it's becoming more and more as a global village rather than different countries with very well-defined high-wall borders. It's not the case anymore. More evident during COVID. But the whole world, the whole pandemic, global pandemic started with one person.
That's right.
And suddenly within 3 months, 5 months' time, the whole world was standing still.
Right.
So these are the three things that is impacting healthcare, impacting diagnostic, and impacting laboratory work. Now, AI is a very interesting aspect. And so AI, to the core of it, is about data. It loves data. It loves, the more data you give it, the better it is. And there is no more subspecialty or place within healthcare that generate really nice data than laboratory. And hence, probably you will see the application of AI being the first place to go into is in laboratory, because there's a lot of structured, really nicely presented data, clean data within it that is ready for AI to apply for it. And what the impact is going to be, I think it's going to be better quality because it's removing a lot of the human intervention, rather human error, into interpretation of data. It makes the process more standardized. Mm-hmm. So the science becomes better. And of course, it will bring the efficiency of testing down. What the impact of that is going to be, and I have to be positive about it, and I think this is my view on why I present. I think today, the cost of laboratory out of the overall healthcare spend around the world is between 2%, 5%, 8%, depending on the location. I think that's going to be tripled, and I'm going to stake my line in the sand. I think it's going to be tripled.
Okay.
The reason is there's more diagnostic being used because of the technology, because of the AI use. There's more focus on prevention and longevity. The technology is getting cheaper.
Yeah.
That means it's becoming more accessible to different people around the world. And it's achieving the right impact in the prevention element of it. So what this does, the overall spend of healthcare is going to come down.
Yeah.
But the overall spend in laboratory is going to go up.
Right.
So their percentage of the overall spend is going to increase. And it's a good news, but also present challenges. The labs and the facilities that are not paying attention to this and jumping on that wagon, again, might lose their competitive advantage in a market that will be very competitive to work in.
Okay. Wow. There's so many nuances and parts to think about when you're considering AI from this point of view, especially. So,
and I've really always been there. So, if I remember when I was in medical school, you're wearing your white coat for the first time. You go to a ward, and it's very nice, and you're very proud of yourself as a medical student. And what you go to surgery, for example. Surgery. Typically, they don't use stethoscope around.
Right.
They usually waiting for a patient, preparing them to take them to theatre and do what they need to do in order to cure or treat certain conditions of that nature. So I remember when we used to go to the ward, and the old ward used to have about 60 patients. There's the professor saying, we are ready to go into theatre and see the excitement around it. They will say, take your stethoscope and examine every single patient's heart. Mm-hmm. Listen to it. And you know that these patients don't have a problem with their hearts. So you don't understand why the professor is asking you to do that and taking away from the excitement of being in theatre. And then you started realizing that you training your ears to be a small AI engine inside your head that doesn't engage your brain in identifying and recognizing certain sounds. So the signal is a sound.
Yeah.
I listen to 1,000 patients or person hearts that are normal. My ears get trained on this data, and suddenly when it's listening to an abnormal one, it pick it up like that.
Yeah.
So that's the principle of what the AI does. So because of the data available in the labs, being it in pictures or pathologist eye, or being it there's so many different numbers of thousands and millions of patients, it's able to identify that these are the normal trends. When it's abnormal, they take it away. Now we're talking binary here, but the AI, what it can do is bring you data from here, data from here, data from here. Look at the holistic part of the holistic picture of the patient, and suddenly come up and the person and come up with solutions and come up with insight that will improve prevention, personalized health, and precision healthcare.
That's amazing. Wow. Thank you so much for all of these insights. This is absolutely phenomenal. I really appreciate your time here with us today.
Thank you for having me.
Thank you.